We'll give everybody a minute to get in. Well, this is not good. I don't see anybody coming in. There we go. Welcome, Brenda. I'll let you talk for just a minute while we're seeing who else comes in. Brenda, we can hear you, but not see you. Welcome. We are recording, and do you see the, in the bottom of your screen, a Q&A? It says Q&A with a little bubble over it.
It's actually on the top. I'm on an iPad.
Okay, it may be at the top then, but it says Q&A.
Uh-huh.
Okay, that's where you'll put questions in if you have them. And if it's a really pressing or seems like it can't wait, I'll interrupt. Otherwise, we'll just keep going. And then if you want to chat or ask any kind of technical or questions of me, the chat box is for that. And I'm going to mute you again, and let me just repeat that quickly. For questions, down at the bottom or at the top of your screen, if you hover, you'll see Q&A. That's where you'll type in questions. If you have some issue or want to chat with the other participants, the chat button is for that. And then we've got Keel from OptiMantra. He's one of the founders of OptiMantra, and they are a company that their goal is to provide integrative medicine practitioners with the best EHR, EMR, and practice management software in an online platform. I'll let him talk a little more about his company, and then he'll introduce our presenter, who's Andy Bellinger with Heroes Business Solutions. So welcome, and thank you.
Thank you, Ellen. Thank you for the opportunity here tonight. And briefly about OptiMantra, we are a EMR and practice management software for integrative medicine. The program is highly customizable for practitioners on the clinical side, and has out-of-the-box capabilities for acupuncture and TCM. And program is, we also provide practice management features. It's fully capable on the point of sale front, starting from doing payment processing to inventory management to fully functional insurance billing. Please feel free to learn more at optimantra.com. And we also give no obligation demos, so you can also book a demo. Tonight, I'm very pleased to introduce Coach Andy. I've known Coach Andy and the Heroes coaching group for more than 5 years now. And we have worked together on some of our busiest and very successful clients. Coach Andy is not only a subject matter expert in terms of assessing and figuring out the health of your business and helping you find opportunities, but also really fun and a pleasant professional to work with. So without taking much time, I would let Coach Andy run with it.
Thank you, Akil and Alan. And I'm honored to be here. I'm honored to share with you information and concepts and tips that I'm confident can definitely benefit. A little bit of background on myself. My background is in logistical administration, accounting, and economics, and broadcast journalism. Went to university and college for those programs. What happened is that upon graduation, in school, we learned the linear. And what happened is that I had the opportunity to train with a mentor, a very close mentor to me, who opened it up laterally, but also took that business aspects and intuitively. It's that little inner voice, and you got to pay attention. in all that we do, to that little inner voice that often does the best guidance for you possible. So I trained for 5 years with this person. He had 5 university degrees himself, spoke 7 languages, loved learning languages. He ended up getting sick. I went and visited him in the hospital on an evening, and he said to his best friend who was there, "You were right, I worked on my mind and not my body." His best friend was a licensed naturopath chiropractor. And he passed away the next morning. He was 51 years old when he passed away. More importantly, he was my dad. And since that point, I dedicated my life to helping people like yourselves who help people improve their health. It is my passion. It is what I see, because there is a weakness there. And it's the business of health. There's 2 parts, the health of business and the business of health. Every one of you can excel within the health of business. That's a given. It's how you strengthen your business of health that often defines how many people you help. And the reality is, in business, you have to look at it differently. You have to look at it from a macro, from a larger perspective than just the micro when you're dealing with the patient one-on-one. Investing in the business of health will balance out, and it doesn't take lots of time. I ask people to spend 3 hours a week, just 3 hours a week in focusing on the business aspects. Whether you're an independent contractor, have your own clinic, even as an employee, business affects us, as this situation definitely defines. So with that, I'm going to share my screen, and I'm going to put on my PowerPoint slide, and we're going to go through these. And if you have really important questions along the way, please don't hesitate to let Ellen know, and then we'll take it from there. So what we want to be able to do is to be able to give you real applicable tips. So not just tips, but tips on what to actually do that can work. You're going to be getting information that there's going to be little gems, and how you apply those little gems will define how successful they are. So a long time ago, my father taught me 2 principles. Principle number 1, the greatest skill of an entrepreneur is the word called help. Success comes with a cast of thousands. So as you see here, helping everyone realize opportunities, and the company's name is not about heroes champion, it's about balancing out the patient, the business person, and the help provider. So the best important skill is the word called help. Success is with a bunch of other people. The more you incorporate a team, the greater the opportunities for success. The second is the principle of the ladder. And this is the only argument I ever gave my father for winning. We would get into heated discussions on many occasions. And one of the occasions he said, "Why do you fight me in everything that I do? I've climbed a ladder this high. Why not take it where I am and go to the next level?" For 31 years, I've been providing guidance for health professionals in all different areas of the health industry. And the concepts that I'm going to share with you on this particular evening, and others, as we continue our building a relationship with the organization, will actually make a difference. So you don't have to climb the same ladders that others have climbed. Take it from a certain point of experience and go it to higher levels. The evolving health consciousness. This is such an important principle. This is such an important principle. I recognized it in 2016. In 2016, I noticed that people looked at health differently. There's always been this movement of alternative healthcare, allopathic healthcare. There's this difference. I believe we're moving into a more holistic healthcare, where it's not about designations, it's about what we offer. And what I noticed in 2016 was the moms and women, and when it comes to health, ladies, they rule. They make the decisions. If you want to know where this health consciousness movement it started from, it's women said enough is enough. It was the moms, it was the professional women, it was women in general. The primary market is women over 40 and men over 50. Secondary market is women over 30. Tertiary market is anybody in pain. Well, in 2016, that market shifted. And it's all around us. It's all around us. There is a change happening in the approach. And what's fascinating is that when I talk about this, when I said, you know, there is a new era, and we're in the early stages in this new era, people talk about health differently. They're empowering their health more dynamically than any other time. Since 2016, no one has disagreed with me. Even in these times, it's not disagreeing. But when you put on your business hat, what are you going to do about it? How are you going to look at this as an opportunity? This is the greatest moments in history for health to change. And it's not going to be a revolutionary change. It's an evolving consciousness. It was a slow moving process. And what has happened recently, it's actually going to accelerate. I will tell you the health industry is never going to be the same because of everything that's happening. And no one disagrees. But what you have to be able to do is, what can you do with this information? The challenge that I see with a lot of health providers is they live in a bubble. They're in their world. The relationship is micro between yourself and your patient, which it needs to be when you're within your patient. But when you're outside of that, it needs to be more macro community, macro state, macro country, macro area, macro world. The primary market now is women over 30. Secondary market is women over 20. With men, it's that 49. I still don't really get it at this particular point. But this whole movement, this consciousness movement, where people explore dynamically health, and there's lots of exploration out there. There are opportunities. And that's what you have to take a look at when you put on that business hat versus from the health provider hat. There are 4 areas that we need to optimize in any venture, okay? We need strategies in each of these. We need foundation. We need to take control of each one. There is the operations where you're actually doing the work. There is the marketing, which brings in the work. Administration, monitoring, leadership directs the work. All the business related stuff appears in any one of these 4. And when you're trying to solve an issue, separate them into the 4. Is it a financial issue? Is it a client, connection issue? Is it the efficiency issue, or is it the overall direction? When we talk about this health consciousness movement, that's a leadership area. That's the macro of looking down on things that allows you to make the decisions. What you have is the business of health and health of business. So those are 2 words I want you to really separate in these times when you're making decisions. There are decisions in the health of business and the business of health. So the business of health is systems in those: administration, operations, marketing, leadership. That's the business of health. Operations, it's about systems. Marketing, it's about creating curiosity, nurturing relationships, strategies. In administration, it's a financial communicator. In leadership, it's strategic planning. You need to look at the 2 worlds, but when it comes to the health of business, it comes around proactive health, active health strategies, and how to work with clients. And there's those 2 distinct markets. There's people with issues, active health issues. There's also a huge population, people who don't consider they have problems. That's a 90 to 95% market share. What you have to do entrepreneurially is look at how you can have strategies for both markets. And what these times have actually done is opened up the proactive market unlike any other time in history. What this opportunity is how can we keep people building opportunities to maintain a higher level of health? What is really fascinating, and I'm going to make a statement, and it's not a political statement, but it's an observatory statement. Everyone out there in all the media are talking about what I call the outer shield. The outer shield is social distancing, the mask, the washing of the hands. What you have in your repertoire is building up the inner shield, is building up this inner shield. And that should be a primary focus for the people who don't feel they have health issues. What you have is a proactive group of people who are now looking for ways to build their inner shields up. You have a population base with underlying causes who need to build an inner shield to protect them from things getting through the outer shield. That is a concept I would encourage every single one of you to really explore that addresses the full market. Tackle the challenge of today is looking at what you need to do with the events that are happening today. And that's where you got to step back. You can't do it as a help provider. And with no disrespect, some of your help provider skills is not the most effective when you're trying to introduce what you do to the community. What you want to do is to figure out what messages you can give that the external community will get curious about what you're offering. Plan for the gifts of tomorrow. I will tell you, the greatest opportunistic market is not going to be this month or next month. It's going to be the fall. Think of all the media attention that's really pushing from a health perspective towards the fall. That, I believe, is going to be where the opportunities truly are going to be defined. And there's going to be dynamic health strategies for both active and proactive health. And of course, we understand the lessons of yesterday. It will never be the same. Most of the plans that people have mapped out in the early part of the year are forever changed. It is a new era. You need to be working new plans. You got to be thinking differently because it's going to be like this for a year, maybe longer. Now people walk around each other, at least we do here. We walk away from each other. We say hello, good morning, but we're 6 to 7 feet away. I go for my morning walk with my son every single day, and the people who are going out for walks, everything is distance, and you line up to go in the store. There's these distances. They say it's the new norm. It's the norm of today. So you please tackle the challenges of today. Take a look at what you need to do in this moment. Plan for where the market is going, and I am telling you, the market, this evolving health consciousness is going into a spike. This is not going to be a slow gradual that I thought of before this all came about. It's spiking. And believe me, moms protecting their kids, their spouses, their family members, and what you have to offer is an incredible shielding opportunity. We never forget the human equation. They're not patients, they're not clients, they're human beings. People make information and decisions with their heart, not with their mind. One of the things we have to be careful, we were in an age of information overload. We are now in an age of educational overload. Your role with every single person is to motivate and inspire, more importantly, empower. People make decisions in a very specific pattern. And the reason I'm sharing this with you, they're all humans walking around out there making decisions. It's a human that reaches in. And somewhere along the line, sometimes we forget that. When we put these labels on them, and that was the primary lesson my father said to me is, they're all human beings. Don't ever forget the human element. Business can be cold. Humanity is never cold. So no matter what the age is of your clients, they are human beings and they make decisions in a very specific pattern. When you do have patients, you need to take charge around the evolving health consciousness. As I said earlier, we have strategies, and you can literally develop your strategy for long-term client retention. It doesn't have to be this cliff that jumps off. However, that's one thing that I've known, that we do lose clients at a certain point. So in all the different health industries that I've with Chinese medicine, health providers, with naturopath, allopathic doctors, in a lot in the holistic care field, we lose them at between the 4th and 6th visit. Now, some of you may have packages that are like 10 appointments. I consider that one visit. That's just an elongated visit. But what happens is is that they leave at a certain time. So I had close to 6,000 inactive files reviewed in industries throughout Canada, the United States, and even in Italy and England. And when they examined their inactive files, what do you think they found out? 95% of the patients stopped coming. What do you think the primary reason was? The primary reason is they felt better. It wasn't because of price. It wasn't because of it not working right. They felt better. And what that literally clued into me, we're in an age of health improvement, not optimal health. You want to help people take to the highest level of their health. Today's society is not ready for that. It's not what we want. It's what you know that we have to, but we just don't want it. So one really good assignment is take a look at all your inactive files. You'll actually surprise yourself that it wasn't negatives. It was very positive. What we didn't have was a way to continue the relationship. And so as you see in this diagram, you have people who come and see you with active health issues. So you see active enhancement, they come in there. Well, after they've gone through active, move them into a proactive. The greatest way to manage a client is actually to do an assignment of how do I retain a client, we'll say for 12 visits. That's the chart that I sort of work with. What do we say in the first visit, in the second, the third, the fourth? How do we communicate? How do we connect with our clients? What's the single most important question you can ask a new patient? I believe the single most important question, I suggest all of you going back and reviewing your intake, if it doesn't have this, and add it. And the question is, what are your 3 expectations you have of me? It's not about a health goal. We do not know our health goals. But if you ask someone, what are your 3 expectations? You're going to then align with why they've come in, why they're here, why they're with you. Revisit that at the 3rd. As I said, a lot of people lose people between the 4th and 6th visit. Remember, in what you do, you may have a package of 6 or 7 or a 10 visit. That to me is just one single step. But so if that was at the 4th, I found that then the 4th visit is often what I call the bridging visit to the 6th. And it's really important to revisit secondary issues at that point. Remember, when I come in, the primary issue I have a problem with, that's what I want you to take care of. And you should know my expectations, because you may be thinking you're in creating the right strategy for them. But in my head, I wanted something different. And if we're not aligned, then we're each going to go on a separate path. But if we're aligned, that also changes and evolves as we go along. So the whole goal of the 4th visit is start addressing, and the best tip I can give you in accessing clients for 1 or 2 more visits is now we're going to start working on these issues. You don't ask what you would like to work on next. When someone says to you, I feel great, you know what they're doing? They're saying goodbye to you. I feel fantastic. And you're saying, great. What I would be saying is fantastic. Now let's start working on these other issues. That will gain you 1 or 2 more appointments. And you're not doing this for economics. You're doing it because it will benefit the patient. You don't ever do anything for money. You do it because it benefits the patient of where there's a value to that benefit. I see so many people in your field and other health fields that are, when they talk about money, they are almost apologetic. Never apologize, and never turn your eyes down when someone asks your fees. Be proud of what you're charging. It does have incredible value. One of the most important lessons in marketing is where I believe where every health profession has failed. My best example is I had my daughter, and last September, she's 21 years old, comes home, and she had her hair done. $189 to have her hair. It was lightened, and I didn't notice a difference, of course. I got daddy spanked for that. 2 weeks later, she goes and gets some B complex vitamins. And she goes, these are really expensive. It's $35. Let's see, $189 isn't expensive. $35 is expensive. And that dawned on me what the problem is. We haven't valued our health. It's more valuable to get a haircut, to do all kinds of other things than it is for health. It's not the consumer's fault. We haven't done a good job explaining how without health, you can't do all kinds of things. A great educational campaign I encourage you to do is called the Health Fits campaign. With a Health Fits campaign, you're explaining or educating people on no matter what they do, the value and the investment they make in their health allows you to do all of that. Take a look at all the commercials that are out there. They show people who with arthritis not able to do anything, and then they take whatever, then they're doing all kinds of things. You know, you bypass all the, disclaimers, all these side effects. The point is, people use health as a vehicle for something else. It's never been health for the sake of health. And this is really important when you're working with your clients, especially in these times. So we have people who are going to take charge, and the evolving health consciousness, like I said, is going to give greater market shares than ever. We have two types of market opportunities: an active, people with issues; the proactive, people who don't have issues. When you have the active, you get to a certain point, that's where the drop off, you can continue the enhancement. Your goal for this chart for everyone is, of course, the optimal health. But there isn't a singular path to get there. Some people will be active and then they'll say, I'm done. Great, move them into a maintenance. Then when they have other issues, they may come back into the active or keep them moving towards the improved optimal health model. That's where I believe you got to continue your journey. But there's people out there, and there's huge population bases who say, I do not have a health issue. They're the proactive. And I'm telling you, that's the greatest market that's evolving right now in these times. The inner shield should be a campaign strategy for marketing. All of you should be incorporating in some way. It's like the immune system, it's the inner shield. I use the word inner shield rather than immune because that's language I can understand. You know, for when I talk about active health issues, I use an analogy that's different. And that's a lot of things of what we do in these times is use analogies that we understand, not the education that you have mastered. We don't go to that school. When I have a health issue, I call it a boo-boo. You give it a scientific term. You give it a language that you have studied. That's why we don't connect. You need to connect with me. In the overall flow of a positive client relationship, if from a marketing standpoint, the way we talk to people, what we call the 6 stages of flow, contact, what are the words, what's the language you use when people call? And there are different types of call. What I would like you to do is make a list of 3 or 4 different types of calls we get. How do we communicate? So an irate client, a person canceling an appointment, a person booking an appointment. What is the language? What's the terminology we need to do to communicate most effectively? The one thing we should never do, and I've seen this happen so often, is apologize. Say, I'm sorry. If you've done something wrong, say you're sorry. If you've done nothing wrong, there's no need to say that word, because the minute you use that word, it means that you are at fault. And there's some scenarios where you're not. The visit, the coming to, and we judge clinics on this. We judge your treatment on this. Contact, coming to, it's about adequate parking. It's about easy access to the location. It's like, where is the place? The sitting experience. I will tell you, you need to modify most sitting areas. Any magazine that is negative, get it out of your office, because those bring the outside world into the inner world. You are a solution. What you want to be able to do in the sitting process is prepare people for treatment. And to me, the first step is either a sense of calm or a smile on the face. Years ago, I worked with people who were in financial crisis. A lot of them going bankrupt. And I've always had different books that were in the sitting area before they come and see me. And one of my favorites, and again, with no disrespect, was a book called How to Shit in the Woods. It was a book on how to go to the bathroom, and it made people smile. Now they were ready for me, because the next logical step is treatment. And the treatment is you empower, motivate, inspire people. But the primary rule with treatment is no one leaves the appointment without knowing how they've gotten better. It's the single most important 101 law, because what do you call every single person that comes and sees you? You call them a patient, you call them a client. I call them a marketing agent. When I put on the business hat, and what's the one thing that they're going to talk about? How you've gotten them better. So give them the words that they can use. The leaving experience is another step. And the leaving experience in most places is a depletion of funds in another appointment. What you have to do is when someone's after their, while they're paying, is talk to them about other things, talk to them about what they love to do, what they're going to be doing. If you do that, you leave with a little bit more dynamic positives, and of course at home. And that's the key. I believe in any time we lose most of our patients at home. We need to develop at-home strategies. How do we stay in contact with people in between visits? And it isn't just about a newsletter. It's got to be very, very strategic. You get judged in every one of these phases. And if you do it positively, it comes to return visits and raving fans. And when you do this effectively, you can create a positive experience. If you really want to know how to build success, it comes from 3 points. Point number 1 is outcome-based medicine, outcome-based healing. It's how do I get people to improved health? Point number 2, positive client experience. And what do you think point number 3 is? Personality. And it's just not yours, it's the dynamic personality of the receptionist, a dynamic personality all the way through of the different people, even the door person, if you have one. You have the personalities all around you. And these components will allow you to be successful. So, but that says, how does a person make decisions? How do people actually make decisions? And I think this is really important, especially in these times. We actually make decisions. I'm wearing this shirt. Alan's wearing that shirt. You're wearing whatever. We buy things. You see my shelves. I got Wonder Woman sitting in the corner there. We buy these things. But when you just take a look at how people actually decide whether to buy or not, it comes in a 5-part process that happens in a blink of an eye. The gatekeeper of all decisions, and your greatest challenge will be with the gatekeeper. So the gatekeeper of all decisions is the heart, the emotions. I like is the primary door opener for making any decision on any purchase. So so what emotions are the ones that impact the decision to move forward? There's the best type of question we often say are open-ended questions. See, that's only 50% correct. The best type of questions are the ones that provide emotional responses. Don't just listen to what a person says, listen to how they say it, because how they answer defines what the gatekeeper is deciding whether they say yes or no. There's so many things that we do that are not the best decision, but our heart says it's okay. The gatekeeper, once you get past the gatekeeper, an immediate right after is called the senses. A lot of times we do a senses analysis. With a senses analysis, which senses affect you? If you take a look at a dental office, when it comes to senses in the dental office, you look at the different senses that are impacted. I remember we're taking my son in as a 5-year-old, and he was screaming as he was heading down to the dentist's office because of that smell. What senses impact the decision? So the gatekeeper, emotions, senses, functionality is perceived use. I told you about this Wonder Woman statuette that I have. I like it. When you buy something, you will find a use for it. It's the same thing with health. Remember I said health fits. Functionality is where does health fit in someone's equation? I want to be able to go faster. Health fits. I want to be able to play with my kids. Health fits. I want to sleep better so I can perform better at work. Health fits. Health fits absolutely everything. We haven't done a good job in explaining functionally how health fits in decisions. Trends. Then we go to trends. So I like it. It looks good. The Ferrari takes me to and from work. Everyone else is buying it. Trends. And I will tell you, trends are becoming more and more important. There are health trends. You take a look last year, before all of this happened. Last year, essential oils really took a leap of popularity. It really leapt up high. And who do you think was the market that was driving that? They were the under 20 was the primary market. It was the young people who were looking at different essential oils as part of their lifestyle. Not necessary for health, but it was that help you sleep, all the different essential oils that are out there. Look at where you fit in the different demographics, but it's got to be looked at from a functional standpoint. It's got to be looked at from a trend standpoint. LAC, what is it? I mean, so what is it? You know, so you say, oh, wow, we do this and we take this. I go, no, it's nothing but a tool. It is nothing but a tool. It's a tool as part of a treatment equation. It's a technique because it's all about improving people's health. The methodology, the tools, the skills combine together to literally help people. What you want to do is to market the conditions. People don't say, I have a holistic health condition that I would love acupuncture for. That's not what people talk about. They go, I have a boo-boo and this is the boo-boo, and yes, we can help them. Our message often is promoting tools where it should be promoting how we can help improve people's health, how we can help take people to having more fun in their lives. It is not the primary reason that people choose you. They choose you because they're looking for you to help them with something. And the messages you give in any time should be more about, we can help improve your health. It should be micro, because people don't come in with macro health issues, big words. They come in with, I got boo-boos. I have boo-boos this. And I often ask nutritionists and naturopaths and allopathic functional medical doctors, even yourselves, saying, what's the benefits of eating blueberries? And then when I ask that, most people in the health industry, and probably yourselves, if you were to write down your answer, you would probably say antioxidants. It helps you poop. That's my words of wisdom. It helps you poop. I understand that. I understand that. That's what we're looking for. What can we take to help us poop? What can we take to sleep better? What can we do to move better? What can we do? And that's where the key in this day and age, it's about marketing to barriers that you, with your tremendous skills and your perspectives, can help. You're in one of the most dynamic industries, evolving consciousness industries out there. In this whole holistic movement, do you see yourself as a leader, as a follower? But it has nothing to do with just a designation. It's with your whole toolkit in helping people improve. I like it. It looks good. The Ferrari takes me to and from work. Other people drive it. You know what's the least important in decision making? The finances. How much will it cost? My daughter got her hair done for $190 and it didn't blink of an eye. When we bypass those four and get to the fifth, and the reason why I'm sharing with this, in the at-home strategy, your messages, you need to check these off. Money is not the primary issue. If it is, it means we haven't passed the gatekeeper. It's expensive only when it doesn't fit. but society is filled and the evidence is all around us, and we buy things that wasn't expensive because we incorporated it into what? Our lifestyle equation. We go after the market multiple ways at the same time, especially in this day and age. I will tell you, come the fall, and again, come in the summer, there is a saying within the healthier care year, from a financial standpoint or from a business standpoint, the health industry does not go from a January to December. It actually goes from September to August. It's broken down into blocks because people's consciousness think differently in different times of the year. So block 1 goes from September 15th until December 15th, of where busy times is usually October, November. And it's because it's almost like the school year. All our, go back now, our heads come back into health. December 15th to January 15th. If you're into acute care, you can be busy all the time. But if you're into chronic care, we pull back a bit. Why do people pull back a bit? Christmas. Just Christmas becomes more important than health. And then the next is from January 15th till June 15th. So you have the shortest to the longest periods of where the second part of January, why is that usually a really big consciousness time? It's New Year's. It's everybody makes the resolutions. It's the New Year's time, and health is always somewhere in there for a few hours or a few days or a few weeks. So you see February, March, April slows down a bit because of taxation, and then it picks up a little bit for May. Up to 60% of your total revenue is made there. And then from June 15th up until September 15th comes slow because of summer vacations, weather, people have distraction. Again, in the acute industry, it's not the same as in the chronic. But when you get to a certain point, of course, some of your patterns may shift out of this, but at least if you have a starting pattern, you can start, how do I market? And then also you got to take events. You take the event of this particular time, but then no matter what, we try to go after the market multiple ways at the same time. I believe come the fall, the niche audience, especially office professionals and entrepreneurs, these markets were the initial markets that have driven the evolving health consciousness. Develop a marketing strategy for a niche audience that's very specific audience. Look at what your micro conditions are. If you're going to market someone at this particular point, I would suggest identify 12 micro and macro conditions. And remember, in all of this, pay attention to what's happening around you. It's outside the bubble. Those underlying causes that we need the inner shield to protect people who have them is where I would be doing the marketing. The proactive is the people who don't feel, but they're afraid of catching something, is where I would be doing the micro and macro. Conditions are how people make decisions. They don't say, I have a holistic care issue, can you help me? They say, I have a boo-boo. List up to 12 conditions and sort of look at what the top 3 or 4 micro conditions that you would go after in this market. Marketing is about having, and we use the word deliverables for all of these, that fit the current market want, and you grow the long-term need. Right now, there are people, if you could connect with you, they would probably come and see you. But if we're marketing hammers and screwdrivers and wrenches, rather than we can help you build a house that stands for 1,000 years, it's going to be more difficult. The other rule is don't use any negatives when you talk marketing. Don't go negative. Negative is, don't say there's so many people this negative. I mean, it's too much. We're being inundated. We're so confused. Fear and terror does not create long-term benefits. What you have the opportunity is to help people enjoy life, because that's what we want. Even in these times, we had a barbecue this past Saturday and we were all sitting outside. Yes, it was only a fewer people than normally we do. It was my son, and it was my daughter and his girlfriend, it was my partner. It was all of the group was there, small, but we still had fun. It's about fun. It's about living life. So micro conditions, generalist is designation, educate people on designation. And finally, some things go into packages. You need to approach the market these 5 ways at the exact same time, creating messages. the way you market today is there's two types of market, folks. There's a micro market, and a micro market is within a 1 hour radius. So what I suggest is you sort of take your, this is where you're practicing. Draw a 5-minute circle, 15, 30, take Google Map Earth to do this, 40, 50, 60 minutes away. And in each one of those, know everything there is to know. Your primary market is within a 30 to 40-minute distance. People will come to see you from there. So if you know that's the micro, the macro is everything else. Like you heard me talk about all these things that are happening. They're happening throughout the United States. They're happening a lot throughout the world. And that gives you an opportunity to position yourself. You need to connect with your local community. And there's two types of marketing strategies in all of this. There is creating curiosity and nurturing relationships. Everything you use in between are tools. I'm going to use my social media to do what? What is it you're going to talk about? So if you were drawing out the perfect marketing strategy, at the very top is understanding the micro and macro markets. That's leadership at the highest level, because success comes from choosing the right conditions to deliver your skills and tools and methodologies for. It's what are those? Then right underneath it is choosing those ones we talked about here. You list those, and underneath those you list what is it you're providing to that micro market first, and then macro. The next under that is what are the tools you're going to use to promote these particular components. What's your toolkit? You know, when you say I'm using educational videos, I'm saying for what? A niche audience, to do a condition, to educate people on your designations or therapies, or is it a package? Every one of these tools link to a deliverable. See, most people just, when they do marketing, they just put it out there and hopefully something sticks. In logistics, everything is strategic. The micro market, these particular components, these key conditions, using our website, using a rec card, making sure our logo on there, making sure our taglines are there, connecting with a community. These are the top right, left here, the clinic name, those are your brand builders. Beneath it is your educators. On the right stop is beneath it are your connectors. On the top right is your educators, and on the bottom right, it is your communicators. It's way to communicate. But they all fit, as you see on the far left side here, to two key marketing strategies. One is called creating curiosity, and that's for strangers. The other is nurturing relationship. What's fascinating, that 95% of our current budgets goes into creating curiosity, and 5% goes to nurturing relationships. In this particular time where you can't go into the community and meet people, count the number of clients you have. It doesn't matter if you have 10, you may have 50. They're your primary marketing agents. If you want to build a marketing strategy in this day and age, it's to be A, make sure what you have fits, and that's what we've been building to. But B, have your clients let other people know. Word of mouth is the single greatest marketing vehicle out there. Everyone agrees, yet very little effort is put into it. One of my suggestions is every one of you should have a membership. And this is not a paid membership. This is just being part of your family, being part of your circle of influence. This is different than social media marketing for the masses. This is for your people. Maybe you do 4 webinars a year. Let's call them the 4 Seasons Proactive Health webinars for your people at no cost. Maybe there are different packages, discounts, educational material. You see at the very, you know, one of these, you see the one called marketing videos in the bottom left is different than educational videos. We don't provide educational videos in creating curiosity. We provide educational videos in nurturing relationships. We provide more detailed descriptions of what we do for our clients. You know, I've had people where they provide all kinds of educational, in-depth stuff for the general public and wonder why they don't have clients. Well, you've told them exactly what they have to do. There's no reason for them to pick up the phone. The whole key for creating curiosity is positive messages for them to email you, check you out, and get interested in what you do. That's the whole thing. And that happens within 3 to 4 seconds of, you know, them looking at your site. Less is best today. Less is best. Empower people in exploring further. Get curious about it. So what we do with our nurturing relationship is let's build a relationship model, create content. You can't go out and meet people this day and age. I got it. But it doesn't mean your people don't know one other person who knows what other person who knows what other person, et cetera, et cetera. The most powerful marketing in this day and age is nurturing relationship. And much of the marketing you do or prepare this particular month should not be for now. The other key thing in creating a marketing strategy, as I mapped it all out, is that being proactive. At this particular point in June, we should have been planning September, October, November. Right now, so you should have everything ready as to what you're going to do in September, October, November. Like, what can I do for July? It's too late. July's here. You may recover some of August, but I believe we're going into a slower phase for some of you. And some of you who's busy, you're not going to be slower. I understand that. But the next big cycle is September, October, November. What is everybody talking about September, October, November? They're talking about a double hit. They're talking about flu. They're talking about COVID. They're talking about colds. We're talking multiply. What can you start preparing in a form of a package or therapies and conditions that you can begin now preparing proactively for the fall? And I will tell you, the niche audiences of people going back into places, offices, are definitely going to be an issue. We're terrified to go into a group location. Like I said, we walk away from each other now. Well, we're all going to be jamming back in the fall. Well, what can you provide as an inner shield that will benefit? So again, proactively plan. And in September, you're doing December, January, February. In January, you're planning March, April, May. So you proactively plan and actively deliver. So you need a marketing calendar. And it isn't just what the big event says, which is important, but what are your plans? And some of the things that you do, like right now, I'd be putting on a proactive campaign for the fall. This is the time to start preparing people for what you're going to actively offer in the fall. Most people, they actively market, reactively hope. But you see, one thing I know about your profession, because I work with Chinese medicine doctors, I work with health providers and with Chinese medicine and acupuncture, you are phenomenal in proactive health. If you think I'm wrong, then you can tell me, but I am not wrong. You're one of the strongest inner shields for proactive that people can incorporate in their lives. And I'm telling you, the market is looking. They're not necessarily looking for designations. They're looking for boo-boos that can be dealt with. See, the mistake has been always negative marketing. If you have this, these evil things will happen. Prevention is not a good word, in my opinion. Prevention says if you do these evil things will happen to you. So shift the paradigm. The paradigm is the word proactive. Incorporate that in your language. I believe in time it will become the search engine word. Proactive health. You want to go after corporations? Proactive health. You want to talk about what's been hit? I've always said this, that I believe health will be the impact negatively on the economy. Guess what? It's been proven right. this is a time now where health can literally be equal as everything else in people's lives if we let them know. And that comes from nurturing relationships of all kinds. I will say the opportunities in the market for positioning as the whole in this health industry is shifting, is happening. What are you doing? And you can't look at it from a micro perspective. I need you to take a step back and explore all this from a macro perspective, and you will probably discover what I'm saying is right. So my challenge to you is, what are you going to do about it? What are you going to do about it? All right, that's the end of this little presentation. If I'm now open for any type of questions you may have, please throw them at me and I will do my best to answer.
Thank you very much, Andy. That gave me a lot of food for thought. One thing we have here in Florida that you may not be aware of is we have what's called snowbirds. So
Oh, yeah.
I was trying to fit your model of, we're a little different in terms of what happens when, but I can see the kind of pattern that's not just a two, you know, if you think of snowbirds, you think of they're here or they're not here, but there's some other littler patterns that happen that seem to fit with what you were talking about.
Yeah, but please remember about snowbirds, because a lot of Canucks do come down. I'm from Canada, so there's a lot of Canadians do go down to Arizona and that. And it's more about the proactive. It's, again, if we're looking at it for active health issues, and that's where I see the challenge is. We wait until somebody has something, then we say, hey, come and see us. And to me, there's massive competition in there, but there's tons of snowbirds that if we can inform them on how they can enjoy life more, have more fun. It's always the intention that we've got to get behind. You'll have more curiosity. So the older population are there to enjoy life. They're there to have fun. So how do you link what you have with that population? And it's all in messaging. So if we've used this from a preventative standpoint, we're not interested in prevention. But if you use it from a proactive supporting standpoint, then absolutely you can have greater markets. And if everyone in your community just saw you once every 2 months in the 6 months that they were there, do the math on the population base.
Yeah, yeah.
That's what we're not doing. We're not letting people know the proactive relationship that health has in all their decisions. And that's where the Health Fits campaign of education. So my language would be right to the snowbirds, and I would mention snowbirds, proactive, and here is a package or a program available.
Yeah, I do know some people that used to market solstice and equinox change of season treatments, and they would have people come in for that. So that
absolutely,
yeah.
Absolutely. But the biggest thing in all of this is that everybody's looking at, you know, this is a negative time. This is a great preparation time. What I believe is going to come next, and the come next is we never want to do this again. And what we have to do is, like the industry has to do, is saying you're correct. And if you do this proactively with what we know, it will make a difference. You'll have greater market share than any other time in history because of the event. And that's where I try to get people to focus on, rather than, you know, what do we do? The best thing you can do for people right now is to make sure that all the health and safety protocols are completely covered from the minute there's contact all the way that they go back home. And if you do that, you'll have that security sense in the space. But other than that, it's the message of proactive, in my opinion. So when people say, what can I do to grow my practice now? Again, I say there's not, you can do more now because you're structured. You can't go out and meet lots of people. What you have the opportunity, though, is a nurturing relationship with your clients, is to see how can I get everyone to refer one other person. And what we do is saying proactively, we'll get more referrals if we educate that way than actively. And actively means you got something. Proactively means we don't want you to have something.
Okay. So in some ways, you're saying also to use language like move better.
Absolutely.
Instead of, are you stiff? Come see me. You know, you want to say, move better. I can help you feel more comfortable or be
Enjoy
happier.
life.
Enjoy
These are
life.
the things we can do to help you. Like do outcome. It's all result focused. It's all about what do you want to do? I want to play with my kids more. Great. These are the things we can do to help. And that's the whole thing. When you ask someone what they're passionate or what they want to do, the only reason we come and see anybody is because it's inhibiting something. I'm not sleeping better. I can't move better. I can't do this. I can't pick up this. But if we use that then as our gatekeeper, our door opener to what we do, because most people, what they do, well, let's promote acupuncture. It's 2,000 years old. I don't care. Can it allow me to play better with my grandkids? That's what we want to know. And that should be where the message is.
I know early on, I used to see people's eyes glaze over when I was trying to explain Oriental medicine to them. And I knew I wasn't on the right track, but I couldn't quite figure out anything different for a while. So,
And then over time you learn, okay, that, you know, it's just another tool. It's an incredible tool, but it's, to me, it's no different than, a nutraceutical is no different than, somebody else is doing chiropractic. It's all the same to me. They're all a bunch of hammers. They're tools, screwdrivers. What you want to do is just to let people know we can help build you a house that stands 1,000 years. That to me is why we come to see you, is for those end results. And that's, that's why, what are your 3 expectations, I believe, is the single most important question on your initial intake form.
okay. That's something I don't think to ask when I'm seeing patients now.
Correct.
So,
And from marketing, okay, you see that, what do you call this thing? It's called a business card, right?
yes.
No, it's not. It's called a network marketing card, because on the back are 5 questions for people to ask me. This has gotten me more contacts than anything else. It's portable. It's very inexpensive to create. And on the back, because also at the bottom, it's like, for answers, go to my website. So we can use simple little tools. It doesn't have to be spending a fortune on social media. That doesn't necessarily attract any attention. Life, and that's the whole thing about people. People meet people. This is about human beings. It's not about anything else. And that's if we're trying to market to clients, it's completely different than trying to market to humans. And so I am a person that if you want to build your practice, meet 10 people a month, 10 new people a month for 10 months, and you will grow your practice faster than any other medium. With technology, the problem is, this day and age, it's still human to human. We've lost the human connection. I mean, we got to be honest with that. So my message now is nurture current relationships. What can you do with your current marketing agents, which is your people you know, and have them refer one other person. Just one other person. And if you do that over a 3-month period and you have 20 people, that's 40 people now. The easiest way and the least expensive way is with nurturing relationship. The most expensive is creating curiosity.
It's interesting. The business I work with has care dollars, and they give people a percentage off their next visit if they refer somebody, if somebody comes in that they've referred. And I've never known if that was really a good strategy or not.
I'm totally, to me, a person refers because they love what you've done. I'm not a financial incentive person. I'm 100%, I'm glad you brought it up because that's a sensitive issue for a lot of people. If you have to give someone money to refer, I don't think it's necessary. All you have to do is saying, please let someone else know. Here, give them my card. And when you do that, on the back are, oh, so how long have you been helping people? That's it. I'm not a fan of selling. If you do this, you get this. I don't believe you can do that. I believe Your clients are so honored to have you in their lives. But what we apparently haven't been taught to tell them, please, if you know anybody else, let them know. That's why I'm a fan of the membership, because then you can do complimentary webinars for your people. And if they bring someone else to see that, someone will get to know you. You'll do more with your education knowledge, but I wouldn't do it for the whole world. I do it for my clients and ask them, please bring another person. Every one of you should have a webinar going on in September that we're now preparing and promoting on about building the inner shield for the fall. Every one of you, but for your clients, not for the general community. It's for your clients, and it's going to be a 20 to 25-minute webinar, and it's not going to be filled with science. It's going to be filled with really solid little tips, but not to the extent that they don't need to come and see you.
Mm-hmm.
Okay? Don't give the house away. Have them, the doors open, they can come in. You will get more mileage from that than anything else you do, especially if it's about the inner shield, the proactive approach for what the fall is about to bring, that all the new medias from the left to the right are all stating the end of the world is in the fall. Great. Let's now see if we can make it work better.
Okay. Well, anybody else out there have some questions? I don't see anything in the Q&A. Now's the time to ask them, or if you have thoughts or a situation you want to ask about. Nope.
We did good then.
Yeah. Well, very nice. Thank you so much, Andy, and Akil, if you're still there. Thank you so much for coming. We are going to post the recording tomorrow and put it out in the email. So hopefully we'll get some people at their leisure listening in. So thank you so much. And I will talk to you all later.
Thank you so
Have
much.
a good evening. Take
Bye-bye.
care.
Thanks, Andy. Bye.
You're welcome, Akil. Bye-bye.
Bye-bye.